The governments of Ontario and Quebec announced this past week that they're backtracking on vaccine mandates for healthcare workers. Each province cites concerns over staff shortages as part of the reason for the decision. The move has drawn a quick backlash from many doctors and nurses. Today, on the Sunday Conversation, does this decision prioritize the freedom of unvaccinated people over the safety of sick patients? Joining me from Toronto, Vas Bednar, Executive Director of Master of Public Policy Program at McMaster University, and Ju-Young Lee, a sociology professor at the University of Toronto. Welcome to you both. This was headlines everywhere on this over the past week, and as well we're seeing this south of the border, not the least of which the president saying that by January he is going to have this mandate for all public sector workers as well. So how is this going to play out? Let's talk about this. Does it make you worried or anxious about going to a hospital? Vas, do you want to start this off?
It actually doesn't make me worried or anxious about going to a hospital because let's remember hospitals did a pretty good job protecting people, both workers and also patients from COVID with PPE. And now we have other kind of supportive mechanisms like testing people who are maybe not vaccinated, better filtration information. So I'm personally not hesitant, but I'm also not an at-risk person. And I think it's a great question because you start to think about those downstream effects of not just prolonging the pandemic, but also, contributing to that backlog where people are not seeking out the medical care that they need.
Yeah, Ju-Young, do you have any concerns about people going in as patients into a situation where they may be dealing with people who are unvaccinated?
I mean, I personally don't, but I think I'm also, privileged in the sense that I'm not, immunocompromised and I'm not in the high risk group. But I think that there is a bit of inconsistency in how provinces are rolling out mandates. Like we live in a province where people who serve us food have to have mandates, but those who are interacting directly with people who are, being intubated don't have to be. And so there's a bit of inconsistency there that I think is worrisome and is kind of a pattern that we've seen throughout this whole pandemic.
Vas, I see you wanting to jump in there.
I agree that the inconsistency is probably the most frustrating aspect, but let's not forget we have other layers of governance, right? Hospitals can still set their own policies, and I know that in Ontario they absolutely are. Now, are maybe less urban hospitals, more rural hospitals, are they maybe a little bit more challenged in terms of the direction they can take? Yes, but in this case, we kind of have those other layers, those backstops that I think should build more confidence in terms of the decisions people are making and the lack of a loss of healthcare workers that we're starting to see, at least in these early days.
Many pointed to British Columbia, where there's 3,000 workers off the job because they're not vaccinated. On the other hand, you can point to places like New York City that has had a 91% uptake, an uptake that went up after it was made mandatory for all public sector workers there. So I guess the question is, and maybe we'll go to Ju-Young on this one, is the government bowing to pressure here from unvaccinated workers? Is that what's going on here?
I don't know if they're bowing to the pressure of unvaccinated workers. I think that we're kind of at this turning point where, we can't imagine a future indefinitely like this. Like the loss of life is terrible. And on the other hand, the loss of livelihoods are also terrible. People, small businesses that are going out of business, losing workers, so there's a kind of like lose-lose situation we're in. And I think given the high rates of vaccine uptake and the fact that we've kind of stabilized now, I think, it'll be very interesting to see what happens in places like Portugal that are moving towards treating the COVID as an endemic and to see like how they fare in this moment, because I think they kind of provide a window into what we might expect as well.
Vas, can we speculate, do you think, on the motivations of governments that are making these decisions not to make them mandatory?
Well, absolutely a political decision. that takes into account public health information. I know in Ontario there was a lot of dialogue with hospitals, and the government got information from hospitals about their stance and kind of a sense of where they were willing to go. Perhaps the province knew that most hospitals were going to bring in a mandate. And then you start to think about, are we going to see clusters? Are we going to see something like a couple of hospitals, and we're mostly talking about hospitals, but we could be talking about the full spectrum of the healthcare system, where almost everyone who works there is not vaccinated, right? And, I say that not as a weird thought experiment, but let's remember early in the pandemic, that absolutely was the case, right? So I think the tension that we're sort of talking around might be the frustration where people feel like, the people who are vaccinated are kind of cross-subsidizing those who are not vaccinated. And now we have anxiety about putting those people in the same setting. So yeah, maybe I'm being a bit of a wild card, but are we going to see that kind of geographic separation? And is that the case study that's going to be what Ontario offers to all of these benchmarks? I'm not sure.
Wild card or no, I see Ju Young nodding along there. What do you think?
Well, I think in addition to what Vass is saying, there's a sense that the unvaccinated are not pulling their weight. And so there's this other sense of frustration that people who went out and got vaccinated, who went through different waves of vaccines that are now discontinued because the government said, well, this age group, we found some risk factors. I think, the people who went out and got vaccinated are also feeling frustrated that there are still holdouts. Luckily, we live in a place where there aren't that many holdouts, and the ratio towards vaccinated is pretty good insofar as public health concerns. So I just think that we're at this point where we have this pandemic fatigue, and everybody's feeling frustrated for different reasons.
Mm.
Do you think? Sorry, Vass, do you want to add something there?
No, I was just agreeing. I'm sorry.
Okay, no, don't be sorry. You're allowed to agree. You're allowed to disagree. That's what this is all about here on the Sunday Conversation. But let's talk about this in terms of the figure that's been talked about. The Ontario Premier saying tens of thousands. My colleagues have been reporting that is, as far as they can tell, unsubstantiated in terms of that is perhaps not the direct feedback that the province got from the hospitals in terms of how many they thought they'd lose. But still, does it point out to the fact that this is a healthcare system, and I say in Ontario and Quebec and so many parts of this country, that before the pandemic was under stress, certainly during the pandemic has been under stress, and the idea being that if you were to even lose a handful of people, it really could push it over the edge. Vass?
I mean, I definitely think that's the sense of where we are. I don't have even the right vocabulary to talk about it, right? Our frontline health workers are stressed, burned out, tired, forget vaccination rates. People are leaving these professions. People are done. And we have a backlog. We have people who are dying because they can't receive medical care and treatment that they need. I read through the obituaries now with actually an eye to that. I hope that's not too morbid, but how do we tell these stories of people who might otherwise still be with us, but could not access medical care because of the other types of care that we're providing in this pandemic? So I don't know if that's useful to say, but it's certainly something that's on our minds. And when we point back to this period of time, we can't say that it was only the pandemic, right? We have a kind of perfect storm on the horizon where our medical system, our mostly public and most cherished medical system, is going to be really pushed to the brink, and it's going to be frustrating, and it's going to be scary.
Ju Young, is there any thought in your mind that this might give extra impetus to the arguments that when this is over or as we emerge from it to put a greater focus on funding and organization in our healthcare system?
Oh, most definitely. So my mother is an ICU nurse in California, and I don't think most people understand the kind of stress and trauma, frontline healthcare workers face when, you see people dying every day, and you're there in their last moments, as they die without family members nearby. I'm also curious, though, to what extent, the voices on social media saying that there's going to be huge walkouts actually translate into real walkouts. A lot of people, right now we live in a moment where social media, the kind of like loudest voices get the most coverage. But at the end of the day, if people quit their jobs and they decide to walk out because of a mandate or the working conditions, it's still their livelihood. This is still, a pretty big life decision. So I know that there's the prospect and the fear of that, but I don't know how much that translates into actual numbers.
maybe not just walk out too, but walk around, right? So when we have hospital-specific mandates, then people can shift to other parts of the health system, which doesn't necessarily solve for why so many health professionals were and probably and still are asking for this mandate.
Final question, though. What does it say about the fact that you have people who are in healthcare, who deal with trying to save people's lives every day, and for whatever reasons have chosen not to get vaccinated? Vass, last word on that.
Well, again, in hospitals, there are other ways that people can protect themselves and others. So let's not equate someone who's not vaccinated with someone that's just rushing around a hospital without a mask on, without washing their hands, without
Right.
taking proper precautions. And in terms of people's personal decisions around their hesitancy, I can't speak to that. I can just look at the literature and what people are saying and sort of hold in my mind that I think it's still good that these people that might have concerns about vaccines are committed and devoted to giving people the best possible health care every day in their profession when they can and working hard to keep themselves and other people safe.
Last word to you, Professor Lee.
I think that I agree with Vass on this, and I also think that we have to do a better job of understanding the sources of hesitancy. You know, there are a lot of people who are vaccinated but are hesitant to get their kids vaccinated. There are people who have received other vaccines but are hesitant about this one. And I think we in social media, at least, we have this tendency to paint everybody who, you know, exhibits any hesitancy as an anti-vaxxer, and it kind of breaks the discourse down. So I think if we could understand that better, we could come up with better public health messaging that could help assuage some of those fears or hesitancies that they have.
Well, it won't be the last pandemic and it won't be the last vaccine. We hope that people will have to be convinced to use. So something to think about there. I want to thank you both. Vass Bednar, McMaster University, and Ju Young Lee, the University of Toronto.